creating a safe place for exploration.
Yeah.
You know, I feel like sometimes in treatment, we have a tendency to take somebody and, you know, feel that based on our experience and working with our clientele before them, we have a good idea of what somebody needs.
Sure.
And then we'll tailor a treatment plan for that may have nothing to do with the client.
Right.
You know, and that's sitting in front of
Sure.
us or across from us. And I think that my experience in treatment was definitely on par with that statement, coming into programs and being told, hey, this is the road to recovery. And it's like, well, how can you say that? You don't even know what I need recovery from, you know?
This is recovery, Roman. Follow the path.
Like, here's recovery.
Right.
And it's like, first of all, what is recovery? You know, as a new patient going into a treatment program,
right?
Like, tell me what recovery, I don't even know what that means. I have no perception of that. And and then I have my own stigmas and belief system. So you're saying I need recovery. Okay, does that mean I'm broken somehow? Or that I'm flawed? Or that I'm weak? You know, recover from what? You know, and if you can't tell me, then how am I supposed to know? You know,
right.
And I think that given an opportunity in a safe place where there is no judgment and there is no one laughing at what I have to say or telling me that this is how it is or that this is right and this is wrong, just a safe place with people who are there to care and walk through that process of discovery, you know? Because before a program can tell me what the best course of action for recovery is, they first have to know what I need to recover from. Sure. And maybe more importantly, I need to know what I need recovery from, especially if I'm coming from homelessness and drug addiction and coming in and out of prison and criminal justice programs. Like, how am I supposed to untangle this and come into a place and be like, all right, here's what I think I need to recover.
Right.
You know, and so I think that that's really important. When we talk about Ava Health, it's yes, we're gonna walk on this journey with you, but we're also gonna give you a safe place to discover and explore what's going on internally, you know, start peeling back some of those layers and discovering other things, and then walking through that process with you, not from a perspective of, oh, no, that's right, and this is wrong, and this is what we think because we're the experts, but coming from a place of, hey, we're in this with you. Right. And you know, we say it all the time, we're not experts. You know, I don't know everything. And I certainly don't. I don't want anyone that I work with to think that I do or have the answers.
Well, and we don't know what you need.
Right.
Because you're you. You are the expert on you. So when we say we're not the experts, we're saying we're not the expert on you.
Yeah.
That you're the expert on you. Roman is the expert on you. You know yourself better than anybody.
Yeah.
So the assumption that you come into a program and then all of a sudden I start to tell you what you're going to do or what you need, right, is something that's so wrong with the entire industry at this point. And
hello, Ava Health.